Greetings everyone. I'm Dr. Gaurav Malik, Director and Head Department of Dentistry, Max Super Specialty Hospital, Mohali. I've been heading the department since 14 years. That's the day this hospital was, started about 14 years ago. And we take pride in the fact that with the great skilled team which we have developed over years, we end up seeing a lot of diverse population of patients, not just the Indian population, but I would say across the world. So today I'm delighted to share a journey of another international patient from Zambia. His name is Musamba Nathan. We've been calling him Nathan for a more easier way. Back home, we keep getting queries through our international teams, and they have been very instrumental in getting all the overseas patients we keep treating. So we had a query where we were told that the patient needs surgery for his temporomandibular joint, the TMJ we call it. TMJs or the dental joint is a very complex sort of a phenomena or sort of a complex problem which people start having, and they don't know sometimes what and how. So back home he was suggested a complete surgical procedure, which is a very major surgery in terms of the joint surgeries. So as I mentioned that we've always tried to stay ahead of the game in terms of our diagnostic modalities, in terms of our technology, in terms of a huge skill team which we have. We have all the overlapping specialists for all these problems. So when we got his query, we asked him to send a basic scans, which he did, but we needed more diagnostics. So when he was here, we took all his scans to understand his bite, where could we see that he definitely has a lot of interferences, especially his wisdom tooth were like kind of stuck there and it was causing the entire bite to derange, and that was the main cause of causing the joint issue. We also figured out a lot of other points where we could make out that his bite, his whole dental structure in terms of, we call it the occlusion, the bite or the alignment. He has an open bite where his teeth don't meet together. So overall, with a lot of diagnostic help, CT scans, we thoughtfully sat down to make a proper plan, which was a very conservative plan. Here, we just made sure that his whole wisdom teeth are taken off. All the balancing in terms of the bite is done. When these two things were done, which took about few weeks, his bite was already settled. His pain was already improving. And about 3 weeks, he was very, very settled. And that's where we decided to go ahead and now align his bite and his teeth so that we have the entire jaw, the entire structure, which is well maintained, which is sort of the right way of the bite and the alignment. And the only way right now for him being an overseas patient is clear orthodontic aligners. So clear orthodontic aligners have also, we've gone pretty far with treating a lot of complex cases with them. A lot of people have a perception that they work with the milder ones, but if you have the right technology and the right back-end services for aligners, you can deal with a lot of complex cases. He's already on them. He's spent 2 months with us. He's improving drastically. Every visit, every day, we see him doing great. So I think that's the whole summary of the entire thing, where I would say that it's been a journey where we feel that our every patient should shine, smile, and be a happy patient overall, and in the most practical, the most conservative, and most patient-centric or individualized plan. So that's what we gave him, and that's what we see the wonderful results. So I'll request Nathan, along with his friends, who've been instrumental in getting him here, and the whole team who has been really great to give us a chance to serve him, to say a few words in his own way, in his own language, in his own comfort. And we like to be hearing from his own mouth how was his whole experience.
Hello, everyone. My name is Musamba Nathan Mulundu, and I'm going to tell you a bit about my journey of how I came to India and what I came for and everything. Well, I came for my procedure. In my head, I was thinking that I'm coming for a surgery because back at home in Zambia, I went through extensive research. I went to different hospitals. I went to Levi Mwanawasa Hospital. I went to Coptic Hospital, all trying to find out what's wrong with my jaw. I had a problem with my jaw on my left side. It was always clicking when I'm eating or always giving me pain at different moments. So I was always in pain. But then, through the help of my brother here, who was in India, he connected me with Mr. George here, who helped me come to India. He found Max Hospital and he talked to the team here, told them, I sent pictures of my research, of my scans, and they told me to come to India. And I was thinking that when I come here, I'm going to have a surgery and it's going to be painful and everything. But no, it wasn't like that. The team here, with the help of Dr. Malik, helped me very, very much. I went through some scans. The AI here is impeccable. The scans they gave me, they realized that it's not really a surgical procedure that I need, but just a few little changes that can make a very big difference. So what they did, they took a few extractions from my mouth, a few little extractions, and made me these illusion aligners right here. These aligners helped me really, really well because they have different aligners for every 7 to 10 days. You change the aligner and it helps you in putting a little bit of pressure in your mouth that changes and it gives you aesthetics, and it helps you with your bite, because the main problem with me was actually just my bite. So with the help of the aligners, everything has been quite well. Mr. George here, he helped me really, really well with finding this hospital. The hospital and the help of the team, they've really done well, and I'm really happy with everything. So I'm wearing the aligners right now, so I can't show you, but I wish everyone who has any problem and anything to do with any type of procedure, it's very easy. You know, if I was speaking my local language, I'd say kuti maisen ku India. Yaliwa because quite cheaper. Bali shonse kuno kuti maisen here. Kuti maisa, and it'll be a very great experience for you to come here.
Actually, as he has put it, my name is George. I've been working with correspondence with the international team here with Max Specialties. And when Nathan Mambo called on me about Nathan, his brother, he had a problem, then I gave him a view to say, please try Max Hospital Mohali, because Max Hospital have got intensive care, and the environment is welcoming. The people around are also welcoming. Also, it is very affordable compared to other states within India. And through the international team at Max Hospital, we did some correspondence and we arranged. He gave us the passport. We sent him the visa application. We gave him the aspects of accommodation, and everything was being settled through the international team here with Max Hospital. And I would urge everyone out there to please look up to Max Hospital Mohali. It is very affordable and it is very welcoming.